The state of Canada's healthcare is a current focus of our work and a number of the affiliates of the Alberta Federation of Labour. As great as it is, and we certainly know there are flaws, but as great as it is, and it certainly is, Canada's healthcare system still has room for improvement and is facing critical attacks and will continue to do so in the future. I mean, that's the history of healthcare. The fight goes on for what was won. So we have three panelists with us today, and I'm going to introduce them one at a time just before they speak. And they're going to address key components of expanding Medicare. And our first speaker is going to be Steve Morgan. Dr. Steve Morgan is a professor of health policy at the University of British Columbia School of Population and Public Health. He'll be speaking about expanding the Medicare umbrella. So, Steve, if you would like to go for it.
Sure, and if people don't mind, I'm going to stand, partly because I'm a little bit nervous and partly because I'm very passionate about what I'm going to talk about, and sitting down seems contrary to that passion. I'm here to tell you for the next 10 minutes about why we should be advocating for a universal pharmacare system in Canada. In this audience, that should be relatively easy. In fact, for all Canadians, the case for pharmacare is relatively straightforward. The fight to get it, however, will not be. The first reason why Canada needs to have a universal pharmacare system is that access to medicines is not a luxury. As all of you know, prescription drugs are an integral part of modern healthcare. In fact, for decades, the World Health Organization has argued that access to essential medicines is a fundamental human right that is well enshrined in international law. Consistent with that, every developed country with a universal healthcare system provides universal coverage of prescription drugs. Every such country except for Canada. If Canadian Medicare is a source of pride for Canadian citizens, our lack of pharmacare should be a source of embarrassment.
Yep.
It's not only wealthy countries that do this. There are literally dozens of lower and middle income countries around the world that provide universal coverage for at least essential medicines. Canada needs to fulfill this obligation to all of its citizens. As many of you know, our current system of prescription drug financing is a patchwork of combined public drug plans for vulnerable populations, most notably people over the age of 65, people on social assistance recipients, and people with various serious and specialized medical needs. We have private drug plans, which are beginning to become under a great deal of financial strain with rising costs and more people working in precarious workplaces. That cover about a third of expenditures in Canada. And a lot of people pay for medicines out of pocket. This slide comes from a 2015 survey by the Angus Reid Institute that found that about 1 in 5 Canadian households is either uninsured or underinsured in the sense that the insurance that they have for their medicines involves high deductibles that require their families to pay most of their prescription costs out of pocket. If we were to fill the gaps and ensure that all Canadians had good access to medicines through a universal pharmacare program, we are certain that this would save lives. For example, this is the percentage of adults in various countries that reported in 2016 that they chose not to fill prescriptions as prescribed to them solely because they could not afford the out-of-pocket costs. What we have here is Canada in the red, where it shows here that 1 in 10 Canadians report that they're not filling prescriptions as given to them because of costs. In the dark blue on the left, those are countries with universal public health systems that include universal public insurance for medicines as well. This includes countries like the United Kingdom, Norway, Sweden, New Zealand, Australia. There are many more, of course, that are like that, but they're not in this international survey from last year. On average, in those countries, about 3.6% of the population, or about 1/3 as many people, reported that they had difficulty filling prescriptions. The countries on the right are European social insurance systems, where by law you are obligated to purchase insurance for your health care, which does include your insurance for prescription drugs. In some of these systems, such as the systems in Germany and France, you purchase insurance through non-profit sickness funds. And in countries like the Netherlands and Switzerland, you purchase insurance through for-profit corporations. Those countries do achieve significant access to medicines in their countries because everybody's covered and the out-of-pocket costs to patients are not significant. Now, if Canada was to bring our level of cost-related barriers to medicines down to the international norms, 1.8 million Canadians would be able to fill prescriptions that they're currently foregoing simply because of cost.
Wow.
Likely, that would mean we would have tens of thousands fewer visits to hospitals by those patients whose health deteriorates as a result of access barriers. Indeed, an Ontario study in 2012 estimated that in Ontario alone, for working age diabetics alone, inequities in access to prescription drugs was enough to cause 800 premature deaths amongst diabetics because their diabetes wasn't well managed. That is the equivalent of an airplane full of Canadians crashing to the ground every year, possibly every month. It's unacceptable, and we need to fix that. And we should fix it even if it costs us more money. But the second reason why we need universal pharmacare is that it, in fact, will save us money, a lot of money. This is the per capita expenditure on pharmaceuticals from the most recent year of data from the OECD, which is 2014, for those same countries. Canada's in the middle, $950 per capita spent on medicines. Those multi-payer social insurance systems of Europe are on the right. They pay about $825 per capita on medicines. That difference alone would save Canadians $4 billion a year. But we don't have a social health insurance system in Canada. You're not compelled to get your Medicare through private insurers. We have a universal public system like the people on the right, on the left of this chart. They spend about $621 per capita on medicines. If Canadians spent that much money, we would save $12 billion a year on prescription drugs. That's real money. So let me just be clear. We are spending billions of dollars a year more on a system that's failing and in fact resulting in premature mortality across this country. It is simply foolish. And importantly for the labor movement is you have to realize that even though your members typically have reasonable drug coverage through your plans, the pharmaceutical industry stakeholders are eating your lunch. Uncontrolled pharmaceutical costs, owing to our fragmented purchasing power in the world market for pharmaceuticals, is resulting in billions in excess spending on private sector benefits for medicines, which in turn means there's less money on the negotiating table for extended coverage of dental services, vision care, mental health, or just wage compensation. So this is a matter that matters to you, and I'd encourage you and your members to get involved in advocating for change. I'm going to just conclude very briefly with the notion that, this can be done. Every comparable country proves that it can, but it's not going to be done easily. Canada should indeed have a universal pharmacare system, but I'm telling you that international experience says that we can save lives while also saving billions of dollars. It's those billions of dollars that are going to result in significant opposition to change. And the reason is an old adage in health economics, every dollar of expenditure in a healthcare system is a dollar of somebody's earnings. And so if we say you can save between $4 billion and $12 billion by having a pharmacare system that will improve access, the industry stakeholders hear that they could lose between $4 billion and $12 billion in revenues. So it's going to be hard fought to win this campaign. We're going to require that labor and businesses work together. We're going to require that the elderly and the young advocate for this, particularly at the federal level. The Trudeau government have a political team that is actually quite savvy about figuring out how to appeal to the median voter. We need to convince the median voter, that's your members, but also your friends, your family members, the people you know at your local community centers, your gym, your places of worship. They need to understand that this matters to them. There's a parliamentary e-petition on right now that was started by a private citizen in Kingston, Ontario. It's vitally important, I can't stress this enough, vitally important that tens of thousands of Canadians sign this petition. Otherwise, Trudeau's team will take it as a sign that Canadians don't care, just like they took the various wavering on electoral reform as a sign that they could back down from that promise. So please, I'd encourage you, if you do nothing else, encourage your members and your friends to look at that petition and sign on, because Canada certainly does need and deserve a pharmacare program. Thank you.
Thank you, Steve.